Sir, you want me to just show the question, wait for half a minute and then tell the answer, sir?
Yeah, that's right. Yeah.
Okay. Here we go then. Okay, so question 1 is a basic statistics question. You all might want to take up paper and make a 2x2 table. Okay, this is question 1. You have a new drug called XYZ. This was developed for neonatal sepsis, for treatment of neonatal sepsis. 200 babies were randomized. 100 babies were randomized to each group. That is, one group of 100 received XYZ and 100 of them received another drug or a placebo. So in the XYZ group, 30 babies expired. And in the control group, which was the older drug or the placebo, 50 babies expired. Calculate the number needed to treat with XYZ to prevent death. So I'm just going to, oh, sorry, I don't have the, okay. So if you're drawn your table, you'll have what? You'll have upper one will be cases. That is whether they have received the drug or not. And you have outcomes. So the upper part of the table will be outcomes in terms of death, survived. And on the left side, you will have exposed or not to XYZ and not XYZ. So if you have total 100 babies in each group, you will have 30 in the first column, 70 in the right-hand column, 50 and 50 in the lower column. So 30 babies of XYZ had the outcome of death, 70 did not have the outcome of death. Placebo, 50 had outcome of death and 50 did not have outcome of death. So this is going to allow you to calculate incidence of death in exposed, which is 30 out of 100, and incidence of death in non-exposed, which is 50 out of 100. So the difference between these two is going to give you absolute risk reduction or risk difference, RD or ARR. 30 by 100 minus 50 by 100. You'll have a negative number because XYZ is actually improving survival here. And from that, you get ARR. So ARR is 20 by 100. And the inverse of that, or 1 by ARR, is your number needed to treat. So here your NNT will be 5. So you will interpret it as that you would need to treat 5 babies with XYZ in order to prevent death in 1 baby with neonatal sepsis. And this NNT is quite good. So for a therapeutic drug, a lower NNT is good. And this drug seems to be working good. That's my first question. The second question, what part of the retina is ablated when you do laser phototherapy for this disorder? This disorder is ROP, obviously. So which part of the retina are you ablating? So you're actually ablating the peripheral avascular retina when you're doing laser therapy for ROP. If there's a demarcation line or ridge between the vascular retina and the peripheral avascular retina, you're taking away the avascular retina by laser photocoagulation and therefore preventing vasoproliferation into that area. So it's the peripheral retina beyond the ridge or the line or whatever that you are ablating in laser therapy. What is defined as plus disease? It's an abnormal tortuosity or abnormal dilatation of retinal arterial vasculature. And the single most important risk factor in the pathogenesis of this disorder is prematurity. Question 3. Sir, can any of the fellows who are already on the panel list answer, sir? It's boring if I tell everything. Identify the structures or the cannulas or the catheters A and B.
You can enter your answer in the chat box, all of you, please.
Okay, so there's you have answered. So A seems to be the umbilical vein catheter and B seems to be the umbilical artery catheter. How did we find that out? Because B seems to be, if you trace backwards, it seems to have dipped down and then come. There's a turning over there. Means that the umbilical artery has entered, gone into the internal iliac, and then turned back from the common iliac into the descending aorta. So that's how we differentiate an umbilical artery from an umbilical vein catheter. This both are erroneously placed. The umbilical vein catheter is probably sitting in the right portal vein, and it seemed to have turned on itself also. So this can cause problems in terms of extravasation of whatever fluids we gave or parenteral nutrition you give into the liver, and can cause even liver hematomas and abscesses. It can even rupture into the peritoneum and cause ascites, parenteral nutrition ascites. The B catheter is also far too deep. You would have preferred it to stay between T6 and T10. You don't want it to go into the ascending aorta. You want it to sit only in the descending thoracic aorta. This seems to have entered the left subclavian artery. So that's far too high for an umbilical artery. So both seem to be erroneously placed. Okay, question 4. How will you explain the following statement to an antenatal couple who have come to you? In an RCT, the relative risk of developing RDS was 0.55 in infants whose mothers were given antenatal steroids as compared to those infants whose mothers were not given antenatal steroids. How will you convert this into a plain language summary to tell a family that they should take antenatal steroids? The slides are not seen, sir?
They're seen.
Okay. Yeah, so I got the answer from Dr. Anusha.
There is one reply in the chat box.
Yes, sir. Antenatal steroids reduce the risk of RDS by 45%. Very good. That will be the easiest way to put it. Do you want to comment on the 95% confidence interval also? Okay, you've written it statistically significant as class interval is less than 1. That's correct. But how do you tell the parents that? You can't tell them statistically significant. So you can that I am 95% confident that my results of reduction in RDS is not by chance. It seems to be a true reduction. Okay. Identify the two symbols whose key I have blocked with blue. This one and this one in pedigree chart. Okay, one answer has come. Gender unknown is the first one. That is the diamond that you're seeing. You need not call it ambiguous. You can just say gender unknown or unspecified. That's correct. And the second one, the black ones, is diseased or affected or yeah, correct. That's right. Disease or affected. Question 6 again. What is p-value? We'll leave out the 95% confidence interval for this time. What is p-value? What does P stand for? Probability. Probability that your results are not true or not correct or due to chance is the p-value. So if you say if p is less than 0.05, it means that the results being due to chance are less than 5%. 1 minus alpha error it is the alpha error. Where should we study statistics from? I think you can just go through. There is one book which I used, but that's 10 years ago. It was called Biostatistics for Clinicians. I think the free PDF is there for download. Otherwise, you'll just have to keep doing journal clubs of very easy topics of common questions that I asked, like p-value, RR, OR, sensitivity, specificity, sample size calculations. These would be relevant everywhere. Tests of significance. I have one more question coming up. Yeah. So the second part of the question is, what is indicated by width of confidence interval? As in, if you have a small width of confidence interval, what does it mean? Or as against, if you have a very wide confidence interval. If you have a very narrow confidence interval, it means the precision of your results is very high as compared, exactly. Narrow means more precise and wide means less precise. Okay, I'll simplify the third part. Tell me two parameters that are needed to determine or calculate the sample size for a study which you have planned, where the primary outcome is comparison between two continuous variables or two means. Any two parameters. There are probably 4 or 5 based on how you design your study, but at least 2. Your outcome is being measured as means. One would be, what is the difference between the two means? Obvious. Yeah, so I got one answer correct. One is standard deviation. Standard deviation will tell you how variable your results are expected to be. The how far it is away from the means, or how variable your results are expected to be, will be standard deviation. Normal distribution or not will probably be used for which test you will use when you're finally analyzing, not for sample size determination, unless of course you want to use two medians for comparison. So I've given you the question here that it is two means. So one is the difference between the two means, that's effect size, then standard deviation. You also need your alpha error and beta error for anything. So if you don't know the answer, you can tell alpha error and beta error for any sample size calculation. Okay. Next is, oh goodness, like, yeah. What kind of breath is represented as the green and what is represented as the yellow in this pressure time scale? What is this green? Here is a clue. And what is this yellow? Yeah, so the green is a spontaneous breath because there's a negativity happening, and yellow is a machine breath. Yeah, you got that. Okay, this is a small calculation question for you. What would be the AADO2 or the alveolar arterial gradient of a baby who is breathing room air at sea level if his blood gas shows a PCO2 of 40 and a PaO2 of 70? If you can just put the formula there in the chat box also, that would be enough. So AA, capital A is alveolar and small a is arterial. So one part of the formula is of course arterial O2. So the first part is alveolar. Alveolar is the one that you need to calculate. So I've written that it's at room air at sea level, which means we're in Trivandrum. So the partial pressure of the entire air, surrounding ambient air in sea level is 760. Pressure exerted by atmospheric air is 760. If you take that we are very, very humid at sea level, the water vapor pressure exerted is 44 or 47. So 760 minus 47, whole bracket into FiO2. In this case, it's room air, so it will be 0.21. Will give you Very good. There's one small part missing there. You've written, Rutvi, you have written correctly 760 minus 47 is 713 into FiO2. Alveolus you need, then you need PaCO2 to be decreased, and you also need the RQ or the respiratory quotient, that's correct. But you also need to subtract the PaO2 from there, that's correct. The next person has completed the equation. So it finally comes to, I think, 40. You can do it for yourself. So you don't need the pH for this formula. That is only a red herring for you. You need only PCO2 and PaO2. Okay. Last but one question. So this is what somebody was saying about normal distribution. So if you have an RCT that's comparing two drugs for something, during analysis, if you're comparing the gestational age between the two groups, which is in weeks, if the gestational age distribution was normal, what would be the test you will use to compare the two groups? We'll stop there. Anusha, do you want to just modify your answer? These are two separate groups of neonates. T-test is correct, but it's unpaired T-test. Okay? Yeah, it's unpaired T-test because you have two separate groups. This is not the same group that you're doing before, after. Neither have I told you anything about matching one case to the next control. So it is the unpaired T-test you will use for a normal distribution to compare two continuous variables. Now, Nisha has given the correct answer for the next part. If you want to compare proportion of neonates having certain outcome between the two groups, proportion, then you will have a 2x2 table and you will use a Fisher test or a chi-square test. If you have a skewed distribution, since it's only two groups, we will use a Mann-Whitney test. That's the part that I skipped. Skewed in the sense, if it's a non-normal distribution, you want to do a non-parametric test, then you will do a Mann-Whitney U test or a Wilcoxon's test. Last question. What is the mode of disinfection or sterilization that you will use for an item that is classified by the Spalding classification as semi-critical? This many statistical questions may or may not come. It's only a trigger, that's all. Trigger to read. So what is the mode of whatever? Semi-critical means what? Semi-critical means an item that is coming in contact with either intact mucosa of the baby or non-intact skin. Critical is an item that is going to go into a sterile body surface or a sterile body space. Non-critical is an item that will go and be in contact with intact skin or nowhere around the baby. I mean, somewhere around the baby, not in contact with the baby. So semi-critical falls in category where it will be in contact with mucosa or in not intact skin. The answer is correct. You have a laryngoscope as an example, and you will use a high-level disinfection. That answer also has come correctly. That's it, sir. Thank you, everybody.
So, thank you very much, Dr. Femita. Thank you all the participants. I'm sure we learned so many things from our expert examiners. I think you have any message for the exam going students?
Me, sir?
Yeah.
Yeah. All of you just need to be not scared, because if you get stuck in one point, then like sir said, you're losing out chances of more questions coming to you. So it's perfectly fine if you don't know something. It's best to just say, I don't know, and move on. Um, um, we can make out reasonably well if you know or don't know when you start the answer. So, and before you start saying something, maybe 1 or 2 second pause to just frame the answer in your mind will be good. If somebody asks you what may be the cause of deterioration of a baby on ventilator, you might want to think for 1 to 2 seconds and then put the answer correctly across instead of just jumping into dope. Maybe they're asking you what is